Unlike our current satellites, which predominantly have been primary care, family medicine, internal medicine, pediatrics, and walk-in, this will be a larger multi-specialty clinic.
The most important thing to me is our customer focus and really getting the input from the patients. The very first meeting of the design and development for Smokey Point, patients were involved in that, and they've continued to be involved in all of our workshops and really have spoken to every aspect of the design for our building. They outlined for us 3 things that were very important to them. 3 customer requirements is what we've called them. We've heard from our patients that they spend a lot of time in our organization for a 10 or 15-minute visit. We took that to heart, and we've really done a lot of work in all of our workshops to reduce that lead time that the patient is here in the office with us.
The goal was to minimize all the extraneous stuff of moving patients around the building.
They want really good access when they come to our organization. They want to get into primary care in 2 days or less, and they want to see their specialist in 7 days or less. So we've paid a lot of attention to that.
At Smokey Point, we'll have around 40 providers and well over 100 staffers.
Seamless communication. They want easy handoffs. They want accuracy in the intake when they come for a visit.
When patients come in the door, they'll be greeted by a concierge to help them avoid waiting in lines if they don't need to be. They may be directed to a receptionist to check in, or they might be directed to one of our self-check-in kiosks.
We have implemented some really great things at Smokey Point. One is our self-check-in kiosk. It really gives the patient the opportunity to check themselves in an easy and simplified manner, so they don't have to stand in line.
After check-in, they'll be guided back to the area where their provider is. Well, they'll be met by their medical assistant.
Another nice feature for our medical assistants is that we will be equipping them each with their own cordless phone, so they don't have to leave the exam room when they need to schedule an appointment for a patient in another area.
The exam rooms are really quite oversized, larger than most of the exam rooms in the clinic, so that we can provide a lot of services for the patient. Once there, they won't have to move around. There's been a lot of work over the last couple of years and really making sure that the patient's experience is top-notch.
And their third requirement has been a complete and accurate discharge plan. They love to get those after-visit summaries. Everything we've done, we have aligned it with those 3 customer requirements.
About a third of the providers that will be at Smokey Point are current Everett Clinic providers, both physicians and ACPs, advanced care practitioners. And then the remainder are people who we've recruited from outside of the Everett Clinic, and they've been really stars, top-notch people that we brought in from around the country.
We looked at what the mission statement for the clinic is and also what our core values are. Really combined all those things together, making sure that we continue to be focused, number 1, on our patients, and that's really driven all the work that we've done.
I've had the pleasure over the last year to be in charge of recruiting the providers that are going to be there. When we've brought them in to interview them and really showed them what we're designing for Smokey Point, sort of the lean concepts and design, the really focus on the patient, the camaraderie and team building and the support for staff, it's been a pretty easy sell.